Hi, welcome to our Pharma Topics channel. Our topic of discussion is stimulant purgatives. Let us see how the stimulant purgatives work. In the villi cells of colon, an important pump is there, that is sodium potassium ATPase. This pump is blocked by the sodium stimulant purgatives. So the transport of sodium and water into the interstitium is reduced. Other than this, they increase the secretions in the colon. In the crypt cells of the colon, they increase the production of cyclic AMP, prostaglandins, and nitric oxide. All these products, they stimulate the enteric neurons and increase the peristalsis. So the first stimulant purgative is Basalcodel. You have to remember Basalcodel is given orally or as a suppository. Basalcodel stimulates the myenteric plexus. It's a prodrug. It's a metabolite, active metabolite. Stimulates the myenteric plexus and leads to production of soft stool within 8 to 12 hours. Whereas suppository works within 15 to 40 minutes. So Basalcodel is a diphenyl methane that gets activated in the intestine by deacetylation. It irritates the colonic mucosa to increase the fluid secretion. It stimulates the enteric neurons to promote peristaltic movements. It is also available as oral and rectal suppository formulations used in bowel evacuation before surgery or examination. The adverse effects are abdominal cramps and allergic reactions. The next stimulant purgative is sodium picosulfate. It's chemically related to Basalcodel. It is hydrolyzed by the colonic bacteria to active form. It irritates the colonic mucosa. It activates the myenteric neurons and increase the peristalsis. It is used to evacuate the colon for colonoscopy and prepare the bowel for colonic surgery. The next stimulant purgative is Senna, kaskara. These are anthraquinone glycosides and they are called amodins. So this is Cassia acutifolia and Cassia angustifolia is Tirunelveli Senna and Rhamnus pursiana. They are household traditional remedies. They are unabsorbed in the colon. Bacteria act on it and liberate anthrol, which exerts purgative action. The action of amodins are similar to diphenyl methanes. They stimulate the myenteric plexus to induce peristalsis. They cause electrolyte secretion into the bowel. In combination with docusate containing stool softeners, it is useful in treating opioid-induced constipation. The next stimulant purgative is castor oil. It is obtained from Ricinus communis. It is a household castor oil. It's a household traditional remedy. It contains ricinoleic acid having a purgative action. It irritates the gastric mucosa and increases the peristalsis. It should be avoided in pregnancy because it may stimulate the uterine contractions. It's a very short information of the stimulant purgatives. I hope it will be useful for you. Thank you for listening. Happy learning. Kindly share this to more of your friends. Kindly subscribe to our Pharma Topics channel for further updates. Thank you.